Hello, this is Dr. Tyler Hamill, chiropractor and nutritionist in Kingwood. Today we're going to talk a little bit about rotator cuff syndrome. You hear about rotator cuff syndrome a lot in athletes, a lot of time baseball players, tennis players, even basketball players sometimes. It's basically a repetitive use injury. The shoulder and the shoulder blade, the shoulder joints, they're moving over and over and over again. Usually an imbalance occurs between all the muscles in the rotator cuff. So what are we looking at with rotator cuff syndrome? We look at all the rotator cuff muscles and we look at the joints. So the main two joints involved, the AC joint and the glenohumeral joint. Usually when the rotator cuff muscles are not working properly, there's extra stress in these joints, and that's going to cause wear and tear. It can cause pain, it can cause inflammation, degeneration, things like that. The main muscles that we look at with rotator cuff syndrome: infraspinatus, supraspinatus, subscapularis, and teres minor. The biceps tendon also plays a part in that. So basically when somebody comes in for an evaluation of a rotator cuff, we want to test all those different muscles. We want to test the joints to see which ones are affected. Most commonly, it's a couple different muscles that are affected and either one or both of those joints that are affected. It's really hard to just have a problem with one joint or one muscle in the rotator cuff because it's kind of complex in the movements. So we test for movements in internal rotation, external rotation, above the head, by the side. We want to know exactly what's going on with these rotator cuff muscles. You can have partial tears in there. If you have full tears in there, surgery is needed. An MRI might be needed to find out if it's partial or if it's a full tear. If it's partial tears or just inflammation or irritation, there's lots we can do. Basically, with therapy, we want to balance out the rotator cuff muscles and take stress off of the two different joints. Thank you very much for watching this video. If you have any questions about rotator cuff syndrome, please give us a call, 281-360-8387. This is really common with athletes, but also people who work at a desk. Because of their posture, they put significant stress on their rotator cuff. If you have any questions for me, info@wellness24.org, our website, www.wellness24.org. You can find out plenty of free information on a variety of different health topics. Thank you for watching this video.